I'll tell you, my job as a majority leader and as someone who's worked on this issue for a number of years is making it happen. You know, there's an old expression, the Lord helps those who help themselves, right? So here's where the themselves get together and try to help each other. So that's what we do here. And it comes down to numbers. It's nothing fancy, it's not big thoughts, but if you have the right numbers, you win. If you have good thoughts and the wrong numbers, you lose. That's as simple as that. You take a vote, all those in favor say aye. If there's not enough ayes, you lose. You can have the best idea in the world. You could solve world hunger, but if you don't have the votes, you lose. It's as simple as that. And the numbers are, I'll tell you the numbers. Here's 4 numbers. Okay? To pass something in the House, 76. 76. Pass something in the Senate, 19. To overturn a veto in the House, 101. Overturn a veto in the Senate, 24. Those are the numbers. Those are the numbers. So when you think about it, if we get 76 people to agree with this, that's not a whole lot of people, is it? We win in the House. We get 19 people who agree with this in the Senate, we win in the Senate. That's it. Okay, so how do you get there? Well, let me talk a little bit about health care. One of the things about health care, we're working on it for a long time, is I think for years, people have been told they don't deserve health care. It's been pounded into people time after time after time after time that people don't deserve health care. They'll say, you know what? Some people get health care and they have low copays. I don't think that's right, do you? You go, no, that's right, because I have high copays. Let's charge high pays for everybody. That's not right. But people do that all the time. Is it right that some senior citizens get health care when they're old and I have to pay? That's not right either. So time after time, people are told they don't deserve health care. Does that job have benefits or not? Inferring that not all jobs have benefits. Well, you know what? When you think, how many people here think that people who make $300,000 a year, do they expect to have health care with their job?
Yeah.
I think they do. I think every one of them. I don't even think they give it a moment's thought. I'm making $300,000, I get health care. But if someone's making $20,000, how many of them think they're going to get health care? They don't expect it. They don't expect it. So our job is to get everybody to expect it. Everybody expects it. Everybody deserves it. That's what we're all about. The other thing that's used against this is, well, if we have a health care plan, it's going to be a bad plan. If once you get government involved, it's going to be a bad plan. Do you expect government to have a good plan?
Yes.
No.
Yes.
Who likes government? I don't know. So one thing is we know we can deliver a good plan. But here's the funny thing. The people who are against health care offer a bad plan. There are plans out there that says we have, you know what, people really don't expect health care. They don't deserve health care, so they should be happy with a bad plan. Something's better than nothing. Right? Do you think that guy's making $300,000? Does he want a bad plan? No. How many people in this room want a bad health care plan? I was at an insurance company one time. There's hundreds of people there. I said, how many people here want a bad health care plan? The funny thing is, no one's yet raised their hand. But they're offering bad health care plans as the solution. Here's a health care plan. It doesn't have those mandates. We don't want those mandates. Do you want mandates? I don't know if I want mandates. Mandates, that doesn't sound like a good thing, does it, a mandate? You know what a mandate is? If the disease you have is not covered, too bad. Mandate says we cover health care. That's what it is. And a number of years ago, we found out that certain health care coverage wasn't covering this, it wasn't covering that, wasn't covering this, wasn't covering that. Well, you know, if life was so easy that if I avoid certain thing, I won't get a disease, well, that's not the way it works. We don't know what you're going to get. So you want to make sure health care is there when you need it. We all pay. When I was 20, I didn't need health care. When I was 30, I didn't need health care. When I was 40, I didn't need health care. 50, you know what? It kind of sounds like a good thing every now and then. So, when I was 20, I could see a fly on that building way over there. I said to my doctor, how close, I can read this from here. He said, says, Chris, before you came in, you can read it here. I said, well, I forget that. So then they take pills to remember that. So the key here is to get people to say they deserve health care and they deserve good health care. That's basically it. Good health care. How we deliver it, then we figure out how to do it. And there's different ways to do it. I want to talk about two ways, particularly that are really good. One way is kind of like Medicare. It's only been around for 40 years, but 40 years. When people first started, if you remember back then, I do remember I was a little kid, but people were talking about Medicare. Oh my gosh, what are they thinking about in Washington, this Medicare program? Well, it's been around 40 years. And there, we pay a little bit, it comes out of your pay, the employer kicks in a little bit, and guess who we take care of? We take care of the oldest people and the sickest people in Medicare. The oldest people and the sickest people. So do they cost money? Yes, they do. Do we pay for them now? Yes. Let's add to that system all the healthy people. Is that going to be as much a problem? I don't think so. That's one way that if we just did that in Connecticut, we would save. Everybody would have health care. We'd have a good plan, right? That's what we want. And it would save $1 billion. Save $1 billion. Less money out of your pocket, less money out of government's pocket. Everybody likes that. And we could have a delivery system. Everybody has health care, and it saves money. That's simple. That's what the scientists and the people studying it's determined. You can have another plan. The other plan 2, it's involves more administration and bureaucracy, but still we'd save a good chunk of change, and everybody have a good plan. Then there's the plans that are not so good. So there's lots of different plans out there, but the main thing is you need a good plan and you got to get the numbers. Now, how do you get the numbers? You know what? You ask people. There are people in this room, in this building who walk around, they live in your towns, and they're trying to figure out what to do. Because it's a complicated issue, and everybody wants to do the right thing, but they don't know what the right thing is. You know how many calls I get about an issue a month? I'll be lucky if I get 2 or 3. People have problems, they call me for that kind of stuff, but to say, here's something I think is important, and here's some information to work on, that doesn't happen. But there are people up here who have different points of view who talk to me every day. They grab me in the hallway, they're nice people, that's why they get the job. And they say, how are you doing, Chris? Here's the thing. You know this idea about universal health care? It sounds good, but there are problems because the government will run it, people really don't deserve it, and we have a plan that's a lousy plan. What do you think about it? It's better than nothing. That's what's offered. So our goal is to make sure we have the votes. Now what's going to happen, nuts and bolts? There will be lots of different bills out there right now. All kinds of different ideas. Good bills, bad bills, in-between bills, mixture of the bills. And people will go through me, have to talk to the people who are on the bottom of the list so they know what's going on. And there will be public hearings where people will come up and testify and say, this is a good bill, this is a bad bill, this one's not so bad, this one's so good. People can come and talk to that, come to it. They can come to the hearing. Sometimes it's a really long time you wait around, and I tell people, spend your time wisely. Don't sit there and wait for yourself to talk. Go up and find a state rep or state senator and talk to them while you're waiting. Why not? Get a cup of coffee, invite them down and talk to them again. Have that one-on-one conversation. Find out who your state rep is. Find out who your state senator is. Invite them to your church. Invite them to a coffee. Invite them to something, and keep talking about it. So that when we get together as a group, whether it's the Public Health Committee, the Human Services Committee, the Appropriations Committee, the Insurance Committee, people say, you know what? I got some calls, I talked to some people, and here's what they want. It's as simple as that. When you add it all up, you have 76 and 19, you win. If the governor vetoes it, then you need the extra. But let me just tell you, there was a couple years ago, campaign finance was the big thing. Campaign finance. There was a group of people that kept saying, campaign finance, campaign finance, campaign finance, campaign finance. And we as legislature had to pass a bill that would give money to our opponents. So we didn't like that so much. Campaign finance, campaign finance. It was fair, but campaign finance. And people said, but Chris, if I give them more money, they'll run against me. Yeah, I know that's true. Campaign finance, campaign. But that's fair though. Yeah, I know it is fair, but they're going to campaign finance, campaign finance. So we passed, we expanded health care. Yeah, that was good, but campaign finance. We raised the minimum wage. Yeah, that was good, campaign finance. And they said, so people were coming up to me and saying, boy, you had a lousy year. I said, we raised health care, we did minimum wage, we got more money for education. Yeah, but you didn't do campaign finance. Campaign finance, campaign finance. So finally we said, all right, we'll do campaign finance. And we did campaign finance because we knew it wasn't going to go away. If you go away and the problem's not solved, the problem goes away in our minds. So you got to keep that beat going over and over and over. You deserve it, and it's got to be a good plan. Thanks.